Hello, hello, test, cheek, hello, 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 cheek, hello.
ಇಲ್ಲ ಬಂದಿಲ್ಲ ಬೇರೆದಲ್ಲಿ ಅದಕ್ಕೆ ಅಲ್ಲ ಅವ್ರನ್ನ ಇಲ್ಲಿ ಕೂರ್ಸೋಣ ಚಿಟ್ಟ ಹಾಕ್ಬಿಟ್ರೆ ನಾವು ವಿ ವಿಲ್ ನಾಟ್ ಡಿಸೈಡ್ ವಿಚ್ ಸೀಟ್ ಅದು ಅಬ್ಜೆಕ್ಟಿವ್ಗೆ ಯಾಕೆಂದರೆ ಕ್ವಶನ್ಸ್ ಸರ್ ಕೆಲವು ಈಸಿ ಅಬ್ಜೆಕ್ಟಿವ್ ಕೂರಿಸ್ಬಿಟ್ರೆ ಅಂದರೆ ಅದನ್ನು ರೆಕಾರ್ಡ್ ಆಗ್ಬೇಕಾ ಚಿಟ್ಟ ಹಾಕೋದು ನಾವು
ಎಲ್ಲ ಬೇಡ ಬೇಡ
Hello, 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 cheek, hello, 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 test, hello, test,
ಈ ಥರ
hello, cheek, hello, cheek, hello, 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 test, hello, test, cheek, hello, 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 cheek, hello, 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 cheek, hello, 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 cheek, hello, hello.
Ishwari to please occupy the front seats. Dr. Alisha, Dr. Shraddha Patil, Dr. Aditya Gopal, Dr. Deepak, Dr. Pankaj, and Dr. Harish. Madam. Other. One member from each team come here. See, we are choosing the position on the table with these sheets. You can take any of them. A, that is A, B, C, either. A is blue. Blue. A, please occupy here. Team B. Team B. Team A is from Sathya Institute. Team B. Manda Institute of Medical Sciences. Team C.
Sir, Team C.
Team C. JNMC Belgaum. Team 4. ಚೆಕ್ ಮಾಡ್ಕೊಡ್ತೀವಿ ಅವರಿಗೆ. ನಂದೇ ಕೊಟ್ಬಿಡ್ತೀನಿ. Done. 1 minute. Sharp 5:55 ಮುಹೂರ್ತ.
Check, hello. Check, hello. 1, 2. Check, hello. Check, hello. Hello. Check. Check, hello. Hello. Check, hello. Check, hello. Check, 1, 2.
Good evening all. Now it is exactly 5:55 of October 16, 2022. We are going to start our quiz competition now. First we'll introduce our team A after taking the chit is Dr. Sai Kishore and Dr. Parameshwari from Sri Satyasai Institute, Bengaluru. Next team is from Manda Institute of Medical Sciences, Dr. Pankaj Diorai and Dr. Harish. Welcome. Then from JNMC KLE University, we have team C, Dr. Aditya Gopal and Dr. Deepak B. Then team D is from Karnataka Institute of Medical Sciences, Hubballi, Dr. Halisha and Dr. Shraddha Patil. Welcome you all. This quiz program actually started as a brainchild of Dr. Manjunath, our president, ISA Karnataka. He has taken lots of pain and initiative in conducting this quiz program, which almost started about 2 months back. With the help and cooperation of ISA Karnataka Mysore City branch, our president, Dr. Usha Madam, Dr. Vaidyanathan, our secretary, and our quiz coordinators, Dr. Dinesh, Dr. Anup, Dr. Mahadev, Dr. Sarika, and myself, we have done our best to conduct this quiz in 3 stages. The phase 1, almost 600 participants registered, and 158 participants, the team took place at the first stage, out of which 24 people qualified for the second stage. From there, now we have got elegant 4 teams for the final quiz. All this was possible because of the sponsorship from Accurella. We have Dr. Tushar Gangadhar, the Managing Director, Accurella. Welcome you, sir. And we have Mr. Shankar, the Director, Accurella South Zone, India. And we have Mr. Ravindra from BMS. And these are the sponsors for this today's event. And we have our event partners are Abhinava Events from Mysuru. Now we'll start our quiz. And I'll request before that our ISA Karnataka President Dr. Manjunath to talk few words.
Good evening, everyone. A warm welcome to each and everyone. Greetings from ISA Karnataka State Branch and ISA Mysore City Branch. And I welcome Dr. Mr. Tushar Gangadhar for our main partnership for this recent ISA quiz program, the state level quiz program. It was decided, somehow we decided in Gulbarga. Actually, we planned to do it in Gulbarga. Now we started in Mysore City itself. And we are planning to continue this program for the next ISA Karnataka and all Karnataka state chapter. It is possible because of Curella. I definitely owe a lot to Tushar and his team for sponsoring this program. I welcome each and everyone. I say good luck to each and every participant. Play nicely and win the prizes. Thank you. Long live ISA. And this is the 75th year of ISA Platinum Jubilee celebrations. We are very proud to Anaesthesiologist and happy and a warm welcome and a very good evening to each and everyone. A good day, World Anesthesia Day to each and everyone. Thank you. Go ahead with it.
And I also thank one more our sponsor, Dr. Basavaraj, Nirmala Group of Hospitals, Mysuru. Yes. The rules, we are the quiz masters and we are the boss. And we are always right for you. Now we have got around 11 rounds. In that, one round is exclusive for audience. We have got exclusive dedicated round for audience and you can win prizes. The rounds run like this. First is bundles. Second is who am I? Third is intensive care unit round. Fourth is a buzzer round. You can all check your buzzers once. Team C. And fifth is Pictionary round, then rapid fire, followed by scoring, round of logos, then all about today, name the product, and the last final is the clinical round. Are you ready? We'll start with our first round is bundles. Sir, Dr. Dinesh, ready? The rules for first round is we have got 4 questions for each team. Questions are not transferable. Each question carries score of 20 and time allotted is 30 seconds for each question. There are no negative marks. Mobile phones prohibited, prompting by audience is prohibited, and our decision is final. Is it clear? Now to team A. Nerve supply of mucosa above vocal cords is internal branch of superior laryngeal nerve, the right answer. And think and answer, because we consider only the first answer as a proper answer. The second question is, which inhalational agent causes least increase in cerebral blood flow? All these are modern used inhalation anesthetic, not historical. Least increase in cerebral blood flow. Isoflurane. Next question is, pregnant with severe features of preeclampsia is posted for lower segment cesarean section. What is the American Society of Anaesthesiologists physical status class? Hold it closer.
ASA 3. ASA 3.
Class 3. Question 4. Presenting someone else's work or ideas as your own with or without their consent by incorporating it into your work without full acknowledgement is called?
Plagiarism.
Very good. It is plagiarism. So this completes the first bundle to team A. Team B, are you ready? Root value of phrenic nerve is
C345.
inhalation agent with highest saturated vapor pressure. Correct.
Yes, Desflurane.
It is 664. Pregnant with chronic hypertension under control for post cesarean section. What is the age physical status class?
Class 2.
Very good. A clinician comes across an unusual presentation of a particular neurological disorder. Detailed publication of this is called last 15 seconds. Time up. It is called case report. Now team C, first web space in the foot is supplied by hold the mic closer and talk. Wrong. It is deep peroneal nerve. That is the only nerve which supplies the first web space both dorsally and ventrally. that is palmar aspect as well as dorsal aspect. Second question is, what is the MAC value of isoflurane?
1.6.
It is 1.2 volume percent atmospheric pressure. Third question, pregnant with peripartum cardiomyopathy is posted for lower segment cesarean section. What is ASA physical status class?
ASA 3.
Wrong, it is class 4. Manipulating research materials, equipments or processes, or changing or omitting data or results such that the research is not accurately represented in the research record. It is called altering the research materials, changing the data, manipulating it. Next question, it is called fabrication. Next, team D. Nerves paired in interscalene block is nerves paired in interscalene block. Wrong, it is C8 and T1, that is ulnar nerve. Highest metabolized inhalation agent in modern anesthesia practices. Among the commonly used inhalation anesthetic agent,
Isoflurane.
it is halothane, 20%. You can remember it as rule of 2. Pregnant with uterine rupture, she's posted for emergency laparotomy. What is the ASA physical status scale class? Uterine rupture, emergency laparotomy.
5.
ASA 5, we take it this as answer. It is ASA class 5E. It is, we'll take this answer. An exploitative academic journal publishing business model that involves charging the publication fees to authors without checking articles for quality and legitimacy is called these type of journals are called what? They're not checking for quality. Last 10 seconds. Take a guess. These are called predatory journals. Okay, this completes round. It completes the first round. No, audience pass rounds are there. Now, we are coming to the scores, please.
At the end of first round, team A is at 60 points, team B at 60 points, team C yet to score, team D at 20 points.
Thank you, sir. Now we'll start the second round. Team A. Here, only one question will be asked in this round for every team. Questions are not transferable. Each question carries 20 marks of 30 seconds each. For each clue taken, if you take any clues, 5 marks are deducted and there are no negative marks. So you can commit the answers. Identify the device. Very good. It is Bascama, so 20 marks. The other clues were, it is also classified as third generation supraglottic airway devices. The other clue was the display of supraglottic devices. And the final clue was the Bascama mask itself. Congratulations. Team B. If you want to, we'll do the next step. Your first clue is this. See carefully. Two more clues are left.
Propofol.
Very good. Propofol. Almost time was getting over. See, the other clue was it is also called milk of amnesia. The final clue was it is related to this particular personality, Michael Jackson. The next question is to team C. Identify the person. During his last days, he was chilling with beer. Clue. The first clue is this. This is equipment for Woods Library. It represents an valve. Time is getting up. If you want,
Clue, sir.
third clue is this. Very good. Sir Ivan Magil will take this answer. So last was the Magil's forceps. So the next is to team D. Identify the equipment. You can see this is a better image. You can see all the values. 98% saturation, 74% heart rate, plethysmogramic wave, respiratory rate is 15. 13.4 is, you need to answer. This is a clue. All this information is derived through this particular probe.
Pulse oximeter.
Refine it. You want next clue? That is an hemoglobin, what it is showing. So there are different hemoglobin. 13.4 is methemoglobin, sorry, the total hemoglobin, and methemoglobin is 1. So it is showing 2 different hemoglobins at a time. Time up. It uses 7 wavelengths in contrast to the 2 wavelengths what is used in regular pulse oximeter. It is called pulse co-oximetry or pulse co-oximeter. Now scores, please. After second round.
At the end of second round, team A is at 80, team B at 75, team C at 10, and team D is at 20.
Now we have got clinical ICU rounds that will be taken by Dr. Vaidyanathan.
So we'll have one question for each team here. Each team will have one question. Incorrectly answered questions are transferred to the next team. It will be done only once. Suppose the second team doesn't answer, it will go to the audience. It will not go to the third team. Each question is based on a clinical scenario or a clinical question. For that clinical scenario or clinical question, you will have 2 questions. So to get 20 marks, you have to answer both the questions correctly. If you answer only one question correctly and second question partly also, you will get only 10 marks still. The past team will get only 5 marks. Okay? Fine. We'll move to the. So read the question carefully. We have a 46-year-old diabetic woman who is admitted with a history of fever and dysuria for 3 days. On arrival to the emergency department, she was in shock and she was desaturating rapidly. She was intubated there, initiated on assisted ventilation. She was infused with 1 liter of crystalloid, and she was also started on low dose of noradrenaline. Broad spectrum antibiotics were started, and she was shifted to ICU. Once she is in ICU, you see this monitor. Look at it carefully. The ICU registrar prompts to this and tell you what to do. So the question, 2 sets of question here is, what is your interface and what will you do immediately? Second is, what are the other methods to determine whatever you are inferred by looking at this monitor finding? Remember, you have to answer both the questions correctly. It is for team A, right? Yes. Yes.
Volume is insufficiently fed. Pulse precipitation
Say loudly.
The volume is insufficiently corrected
Yes.
and pulse pressure variation.
Yes. First part is correct. What are the other methods to determine the same?
We will arterial trace will do variation and PV volume variation. And central SV, CVP.
First pressure variation. See the CVP.
We can take it. So systolic pressure variation, stroke volume variation, passive leg raising, end expiratory occlusion test, IVC, distensibility index. CVP we don't take. CVP should never mention. Okay. We'll do the next question. So it is for team B. So we have a 56-year-old chronic smoker who has got a chronic asthmatic bronchitis. He is having worsening breathlessness. He was intubated after a trial of failed NIV, and he is being ventilated with pressure control mode with respiratory rate of 20, PEEP of 8. FiO2 was started with 100% and reduced to 60%. It is a ulta. I'm sorry about the printing mistake. So 6 hours into the intubation, patient is still in respiratory distress. He has developed hypotension and the ventilator started giving alarms. So pneumothorax was ruled out clinically as well as by taking an X-ray. The ventilator waveforms are depicted in the monitor. The key points are highlighted for you. So look at the highlighted points, look at the case scenario and tell me what is your inference. In other words, what is the diagnosis and how will you optimize the patient with respect to your diagnosis. Chronic asthma patient intubated, has went into hypotension after some time. Pneumothorax has been ruled out. Okay. Look at the monitor and tell me what it is. First, that is first question. After looking at the monitor, how best you can optimize the patient. That is the second.
Auto PEEP generation.
Yes.
And we have to increase the expiratory time.
Then anything else? Expiratory time plus?
Reduce the tidal volume and increase the respiratory rate and
Reduce the tidal volume.
And increase the respiratory rate.
Increase or? Okay, Anil has prompted me, no explanation, no time taking things. Auto PEEP we can take 10 questions. Second, we can give 5 marks, not more than that. Okay. So decrease the respiratory rate, decrease the tidal volume, increase the IE ratio, allowed sufficient time for expiration, increase the peak expiratory flow. Very important. Fundamental aspects for management of any COPD patient. Okay. Should always reduce the respiratory route whenever you have detected auto PEEP or dynamic hyperinflation. Okay, coming to the third question. It's for team C. So we have a 50-year-old diabetic male who is admitted with repeated episodes of vomiting and loose stool. So the patient's investigation reports are as follows. So look at the highlighted thing. His pH is 7.19, PCO2 is 81, PCO2 is 28, HCO3 is 11, glucose is 660, lactate is 2.2, sodium is 119.5, urine ketone bodies are positive. Okay. Again, what is the diagnosis and what is the management? Please remember, for the first part to be correct, you have to answer both. What is the diagnosis and what is the management? Second part, what is your approach to hyponatremia in this patient? So to get 20 marks, you have to answer both the questions. And your time starts now.
The patient is suffering from diabetic ketoacidosis.
Yes.
So we'll be starting IV fluids.
Yes.
And we'll be starting insulin infusion.
Yes.
Along with that, we'll be correcting the potassium also, if needed. Hyponatremia, we'll be correcting with the 3% normal saline.
Okay, wait. First question, we will take it. Second question, can we pass? Second is wrong answer. We'll pass it to the next team. Second part of the question. What is your approach to hyponatremia in this patient? Hold the mic and tell. Why?
Corrected with IV fluids.
Why sodium correction should not be given?
So it is because of dilutional hyponatremia.
So what is the word? What is the term I am looking for? I think we can accept it, sir. What do you say? The grace marks for anesthesia pitches is good enough. So whenever the blood sugar is more than 500, 600, it is pseudo-hyponatremia. Whenever you get a patient with hyponatremia, you should always rule out pseudo-hyponatremia. Pseudo-hyponatremia is very common in hyperglycemia. For every 100 milligram rise of blood glucose is above normal, the sodium falls by 1.6. So you have to look at the corrected sodium. If you get the corrected sodium, it will become 128. So sodium correction is not indicated. Fluid, 6 liters deficit, insulin in the rate of 0.1 units per kg per hour. Yes, coming to the last question. We have got a chronic alcoholic and diabetic with perforated peritonitis. He had a blunt injury abdomen. He had a brawl 3 days back. He entered laparotomy with ileostomy, shifted to ICU. After surgery, still irritable, restless. He is in shock. He has got decreased urine output. His lab values are as follows. So sodium of 158, potassium of 5.1, sugar of 238. Again, 2 set of questions. What is the management? What is your approach to his hypernatremia? Question is to team 4. We've got 40 seconds. Yes.
We'll be giving fluids, sir.
Which one?
No. Ringer lactate solution, sir.
Take one more guess. Grace.
0.5% NS.
Think it's wrong. We'll pass the question to team A. You'll get only 5 marks, either of the way.
D5.
Sorry. Okay. What is your approach to hypernatremia? Time up, sir. Yes. What do you want to do with? What is the management? He's in shock. He's got decreased urine output and BP is 80/60. Which fluid? Resuscitation 5D. Sorry, you are also wrong. We'll pass to the audience. First time it has got passed to the audience. Bad one. Okay. So he's in acute dehydration and shock and hypertension. Whenever a patient has got hypernatremia with shock, fluid of choice is always NS. You have to correct the volume. Then you calculate the water deficit. And then based on the water deficit, you correct it with half DNS or 5D with insulin. Whenever patient is in hypotension, even with hypernatremia, fluid of choice is NS only. Thank you.
At the end of third round, team A is at 100, team B is at 90, team C at 20, and team D is at 25.
Thank you, Dr. Vaidyanathan. Thank you, Dinesh sir. Now we are at buzzer round. Once again, check your buzzers. Check your buzzers, please. Check ಮಾಡಿ. No, once somebody is on, it will not count. So whoever presses first, then it will get freeze. You cannot press it. Check your buzzer. You don't do anything. Correct. Yeah, urgent. Third. Now, buzzer is working. See, rules is you have got a set of 8 questions. Team which press the buzzer first will answer it. Questions are not transferred to the next team. 20 marks for correct answers. 10 if you answer it half, and 10 negative mark if you tell a wrong answer. So before pressing buzzer, read, understand the question. If you press it early, the question will stop there. Half question. Is it clear? Are you ready? Now, question starts. Identify the event and the personality in the picture. Team D. Close.
It's demonstration of usage of ether in Massachusetts, Boston by WTG Morton.
Personality, WTG Morton. Okay, wrong. It will be So it is a public demonstration of nitrous oxide. It is not transferred. And it is dentist Dr. Horaswell. Next question is, keep your finger on the buzzer. Identify the scan and what is its significance. Team A.
This is the ultrasound of the airway.
Wrong. It is the ultrasonic measurement of optic nerve sheath, and greater than 6 mm indicates raised intracranial tension. There is a diagnostic feature, non-invasive method. 5 to 6 is indeterminate and less than 5 is normal. Now the third question, are you ready? You should hold your mic closer. What is shock index and what does it indicate? No time limit. Shall we go to the next question? Okay. Everybody agree? Or you want to press? Shock index is a very simple measure of heart rate divided by systolic blood pressure, which is a very simple method for clinical usage to diagnose the degree of hypovolemic shock. Next question. Finger on the buzzer. Identify the scan and what is the blue line indicated on the sonoanatomy. Team C.
Scan is brachial plexus supraclavicular block.
Correct. First part is right. So you'll get 10 marks. What is that blue line? Blue line. Now it is there. You can see the vessel. Below the vessel, there is one mark and one more shining hyperechoic structure lateral to it.
Pleura.
Very good. It is pleura. Full marks for them. So this is a wrongly kept scan picture where the needle is almost entering the pleura. Next, name 2 gases that are supplied in liquid form in the cylinder to the operating theaters. To the operating theaters in the cylinders. Yes.
One is nitrous oxide.
C. Correct.
Liquid form to the OTs.
We'll give full marks. These next questions are only single answer questions. Next, from 5th onward, single answer questions. So it is carbon dioxide and nitrous oxide. From 5th onwards is single. Next, which gas has been allotted with spin index of 3 and 4?
Carbon dioxide.
Sorry, no gas is allotted this number. This was a bouncer. Next, ready? What is the service pressure of nitrous oxide cylinder when it is half full? Team B.
Seven. 750 psi.
Very good. Even if it is half full, it does not obey the gas law. It is 750. Very good. Now, question 8 is identify Team C. Got any more time limit for this round? Very good. Now, next question is, what is the preservative used in this C time? Team C. Again, what is the answer?
Methyl paraben, sir.
Wrong, no preservative in this. It is preservative-free lignocaine. Minus 20. Now, next question. Identify.
Diameter index safety
Correct.
system.
Diameter index safety system, safety device. So this concludes the buzzer round. Dr. Dinesh. How was it, buzzer round? You went up, came down also.
In round 4, Team A scored 10. Team B scored 20, Team C scored 30, and Team D scored -10. So the total at the end of round 4 is Team A is at 110, Team B is also at 110, Team C at 50, and Team D is at 15.
Very clear? Any doubt with this? Okay, now we'll continue with the next round. Is round Pictionary round. Now I request Dr. Anup to continue with this.
So this round is Pictionary. The rules of the round is each team will have one question and there'll be words that you'll be shown pictures. You have to pick up an anesthesia related word. Each questions are transferred to audience only. It is not transferred to any of the teams. Each question carries 10 marks and 20 seconds, and there's no negative marks. Okay. So team A, this is your picture. Identify the anesthesia related word in this.
Sugamadex.
Yeah, that is the correct answer. Next, team B. This is your picture. Identify the anesthesia related word in this.
Last 10 seconds. Time off.
Audience? Yeah, it is a tram. It is a tram, and that is a doll. It's a tramadol. Okay. What's your name? Priyadarshini from Mysore Medical College. So next, the question is to team C. Identify the word in this picture.
Ketamine.
Yeah, that's the correct answer. It's a kettle and mine, so it is ketamine. Team C gets full marks. And next is team 4.
Good.
Yeah, that's correct. It's IGEL.
Thank you, Anu. Now we'll move to the next. Before going to that, the final scores at the end of fifth round is after this round we'll have a 2-minute gap for a serial advertising.
At the end of round 5, Team A is at 120, Team B is at 110, Team C at 60, and Team D is at 25.
Now we'll begin again with the rapid fire round. We've got a pack of 10 questions. Each team will get a pack of 10 questions. Questions are not transferred. Each question carries score of 10. 10 negative. So time limit is it at the end of the first question and 100 seconds. Not 1 minute, it is 100 seconds. Is it clear? Negative score if you answer it wrongly. Let us start. I request audience not to prompt. H1 timer ready? It should start at the end after asking the first question. Team A. The sequence of CPR is
circulation, airway, breathing.
good. Minimum fasting time allowed for clear liquids as per the recent fasting guidelines is
2 hours.
wrong. Drug of choice for preventing and reversing the symptoms of malignant hyperthermia.
Dantrolene.
Very good. Intravenous regional anesthesia was first described by
Bayer.
Will take. Read this law, gas law.
Boyle's law.
Good. First PGXL was held at
Next question.
Mysore. Enigma 2 trial is about it is about nitrous oxide. Identify the triad of microganthia, cleft lip, and glossoptosis. Will, correct. Reversal agent of dabigatran is it is recently FDA approved. It costs around 1,60,000.
Next question.
Dose of 20% lipid emulsion is for treating local anesthetic toxicity.
1.5 mg per kg.
Correct. We'll take it. Congratulations. Good. 90 seconds. They have completed 10 questions. Team B. Team B. Are you ready? Mike, close it, please. Because it is live on YouTube. At the start mode, start. First line of treatment for unstable tachycardia is
Beta blockers.
wrong. Second step of IDA guidelines for unanticipated difficult intubation in obstetrics is
Next question.
PK value of lidocaine. The pH at which
Low PK.
Next question.
Who suggested the word coconization of the spinal cord as an alternative to general anesthesia?
Next question.
Read this gas law. Constant pressure, volume is directly proportional to the temperature.
Charles.
Huh?
Charles law.
Correct. PGXL 2023 will be held at.
Next question.
POISE 2 trial is about.
Next question.
Triad of bradycardia, widened pulse pressure, and irregular respiration is called.
Cushing's.
Correct. We'll take this answer. Congratulations. Now, rapid fire for team 3. I think you would have got the last questions. That's why you put chits. Now, timer. Antidote for heparin is?
Protemin.
This is ninth.
Oh, sorry. We'll retime it. Ready? The post-ROS targeted temperature is maintained at, after reversal of spontaneous circulation, targeted temperature is maintained at
36 to 38.
wrong. 36 to 38. Wrong. We don't take. As per ASA 2022 guidelines, the first step following initial unsuccessful attempt of intubation.
Call for help.
Huh?
Call for
Very
help.
good. Very good. Next. Barbiturates are absolutely contraindicated in.
Porphyrias.
Good. Laryngeal mass carrier was discovered by.
Archie Brain.
Good. Read this law. At constant volume, pressure is directly proportional to the temperature.
Gay-Lussac's.
Good. Kisakon State Conference 2023
Mysore.
held at. Correct. NAP 5, National Audit Project 5 is about. From Royal College of Anesthetists.
Skip.
Triad of oxidizer, an ignition source, and a fuel is, what is this triad?
Airway fires.
Very good. We'll take. Antidote of dexmedetomidine is.
Atropine.
Dose of dantrolene to prevent malignant hyperthermia.
2.5 mg per kg.
We'll take this answer. Next. No, that's why instead of 1 minute, we want them to score. Now, team 4, ready?
Yes, sir.
Hold your mouse, the mic closer. Rate of compression of CPR is?
100 to 120.
Yes. As per DAS guidelines, Difficult Airways Society guideline, maximum number of attempts of laryngoscopy allowed in critically ill adult is?
2 plus 1.
3 times correct. The pH of 2.5% solution of thiopentone sodium in water is after dilution.
Skip.
Acid aspiration syndrome is also known as? There are 6, 7 different names. You can tell any one of it. Or with a person who named it.
Skip.
Read this gas law. All balloons have the same volume. This means they all contain the same number of molecules, which forms the part of
Skip.
ideal gas equation. Total number of anesthesia PG seats in Karnataka. These are all similar
Skip.
questions for everyone. It is around 504 MD seats and 150 DNB seats. NAP 7, National Audit Project 7 is about. This is a recent NAP 7 guideline published 2020.
Skip.
Rule of three algorithm refers to which drug?
Oxytocin.
Correct. Reversal agent of rivaroxaban is, once again, last year it got approved from FDA. Yes. This completes the rapid fire round. We made an attempt to see that you get all the similar questions with a similar length.
In the rapid fire round, Team A scored 50, Team B scored 10, Team C scored 60, and Team D scored 30. So at the end of 6 rounds, almost we are halfway through. Team A is at 170, Team B is at 120, Team C is at again 120, and Team D is at 55.
Team A. Okay. Team A is leading the quiz now. Still time is there. You can catch with them. Now, the 7th round, round. One question for each team. Unanswered questions are transferred to the next team. You got a chance. Each question carries 10, and past question, if answered correctly, will get 5 marks. Is it clear? Team A. Identify this scoring system. Seconds. Past question will carry 15 seconds, will get 15 seconds time and 5.
RCRI.
Correct. Very good. Team B. Question is Team B. Team B scoring system. Respiration, oxygen saturation, consciousness, circulation, and activity. One, two, three, up. Answer is modified all-read scoring system of. Okay, I'll give the next question. Some question. Now the question is to Team C. You'll get one more question for this. Identify the scoring system. Can you name it?
Ramsey sedation score.
Good. You get an extra question for 5 marks. The question is for Team D now. Identify this. If they don't answer, Team A. Time up. Team A. No? Pass it to.
Mel score.
Good. This is recently been introduced even for organ location also, for our donor also. Initially, it was for a perioperative mortality in liver disease. Now, even for liver transplantation, for screening the donor. There is a recent update with this. Coming to the 8th round, I request Dr. Sarika to continue with the round of logos. Observe carefully.
In round 7, Team A scored 10, Team C scored 5, and Team D also scored 5. So at the end of round 7, Team A is at 180, Team B is at 120, Team C inching 125, and Team D is at 60.
So coming to the logo round, each for one question for each team is for 30 seconds. So the marks considered is only the first answer. Questions are transferable and it will be there only for 15 seconds. So the first team will get it for 30 seconds. Next team will get it for 15 seconds. Each question is for 10 marks and transfer question 5 marks. So both time and marks are reduced and no negative marks. So the first logo you have to identify is, Team A. The complete logo has to be mentioned. Proper logo. The next team. "15 seconds, next team. No, it is Indian Resuscitation Council. Next question. Team B. Yeah, identify this logo. Team B. Okay, Team C.
IDA.
Okay, very good. All India Difficult Airway Association. The next question for Team C is,
ACCM.
very good, Indian Society for Critical Care Management. The question for Team D is,
Carefully. What is there?
no. Team A
ICMR.
is Society for Study of Pain.
We have deliberately hidden the pain. You can see there.
Okay, the final marks after this round.
Thank you, Dr. Sarika. Scores, please.
In round 8, Team C scored 15. All the other teams failed to score. So at the end of round 8, we have Team A at 180 points, Team B is at 120, Team C is at 140, and Team D is at 60 points.
You have got a twist. Instead of you answering, your friends will answer for this. You can get whatever the number of your friend, teacher, friend, colleague. If they don't answer, you will get a negative score. If they answer, you will get whatever the score allotted. This is just a twist we got now. You can give any phone number. You can call from your number also. Team A, keep ready all. So one question for each team. It is only for 30 seconds after they start answering from the other side. Only first answer is considered for scoring. Questions are transferred to the next team. You can keep your friend number ready. Each question carries only one answer. Anybody. mother, father, teacher, friend, whomever, and it may not be truly anesthesia topic. You can take a guess. Past questions carry 5 marks. There are no negative scoring. Huh? That's how it is decided. Huh? Next number you call. First number, or you can choose randomly one audience from here. If nobody is taking, 2 friends are not taking. Except this table, you can choose anyone. Ready? Numbers are ready. You call. ನಿಮ್ಮ friend ಯಾರು ಅವರಿಗೆ ಹೇಳಿ ಅವರಿಗೆ you tell them. Brief them. ಇಲ್ಲ they cannot answer. It's just a twist. They can't answer. No. ಇಲ್ಲ ಅವ್ರು ಆನ್ಸರೇ ಮಾಡಂಗಿಲ್ಲ. Ready? Team A is ready now. Okay. You can read question for them. Okay. Time. They're ready. If they are on live on YouTube, they can see this simultaneously and they can help you. Delay. Okay. So apart from World Anesthesia Day, 16th October, that is today, is also celebrated globally as
Yes, sir. Hello, sir. Yes, sir. Please tell the answer, sir. Apart from World Anesthesia Day.
Apart from World Anesthesia Day, 16th October is also celebrated globally as time up. No. Next team. Sorry, team B. You can call now. If they're not answering, from last row, you can choose somebody. You're ready now? You can talk to keep ready. They should be. Otherwise, you'll leave. Last attempt I'll give. Otherwise, we'll skip this question. ಈಗಾಗಲೇ ಡಿಸ್ಕಸ್ ಮಾಡ್ಕೊಂಡ್ಬಿಟ್ಟಿರ್ತಾರೆ ಗೂಗಲ್ ಮಾಡಿ.
There's one question here. Apart from the World Anesthesia Day, 16 October is also celebrated globally as what?
Hello, Dr. Akshay. The question is, apart from World Anesthesia Day, 16th October is also celebrated globally as Spine Day. Wrong answer. We don't take this answer. The answer is World Restart a Heart Day. don't discuss. The questions are there. Please do not discuss among the audience. So next, team B, you can call the same person. Because this is about this topic is about what is today. So they may get an answer. That is also. Team B. Hello, you also can call them. Hello. Dr. Archana. Dr. Anil here. ನಮಸ್ಕಾರ, ನಿಮ್ಗೊಂದು ಕ್ವಶನ್ ಇದೆ. ನಿಮ್ಮ ಹುಡುಗರ ಬದಲು ನೀವು ಆನ್ಸರ್ ಮಾಡಬೇಕು. October 16th, today, Indian Bollywood's dream girl's birthday, who is also current member of Parliament of India. ಹೌದು, October 16 ಇವತ್ತು ಅವ್ರ ಬರ್ತ್ಡೇ. ಹೌದು.
ಅಮಿತಾಬ್ ಬಚ್ಚನ್ ಅಂತೂ ಅಲ್ಲ.
Actress Dream Girl. She's also known as Dream Girl. Correct. ಆಯ್ತು, ನಿಮ್ಮ ಹುಡುಗರಿಗೆ ಸ್ಕೋರ್ ಬಂತು. Thank you, congratulations. So today is our 74th birthday. Now the next question is Team C. ಏನ್ ಮೇಡಮ್ ಏನಂದ್ರಿ? ಅದಕ್ಕೆ ಇದು ಫನ್. ಅದಕ್ಕೆ ರೆಡಿನಾ? ರೆಡಿ ಇದ್ದಾರೆ ಸರ್. ಮೈಕ್ ಕೊಡಿ. ರೆಡಿ ಇದ್ದಾರಾ? ಸರಿ, ರೆಡಿ.
Hello, sir. Ready, sir?
Yeah, you're ready.
On this day, one of the world's best all-rounders of all time made his test debut from India against Pakistan. Correct. Team D. They are ready? Dr. Srinivas, the question is, today is also observed as dash worldwide to raise the awareness on issue of hunger and the waste of food. Today, October 16th, it is also celebrated as dash day. It is related to raise awareness on issues of hunger and the waste of food. Hello? Dr. Srinivas, are you there?
Yes, audible, sir.
Yeah. In the memory of United Nations organization, some body, so to raise awareness on issues of hunger and waste of food, this day is also celebrated globally as, take a guess, hunger and waste of food. To raise awareness on issues of hunger. Okay, it is time up. Team A.
Audience.
Our beda. ಈಗಾಗಲೇ ಗೂಗಲ್ ಮಾಡಿ ಆಲ್ರೆಡಿ ಫಸ್ಟ್ ಟೇಬಲ್ ಡಿಸ್ಕಸ್.
No, last.
ಅಲ್ಲಲ್ಲ, ಹಂಗೆ ಆಲ್ರೆಡಿ ಡಿಸ್ಕಸ್ ಇದೆ.
This last.
You want
Last.
Shankar.
No.
You want to take them? ಆಯ್ತು, ಹೇಳಿ. Correct. World Food Day. We'll give marks to Satyasai. No, ಇಲ್ಲಿ food ಅಂತ ಡಿಸ್ಕಸ್ ಮಾಡಿದ್ರು, ಕೇಳಿಸ್ತಾ. Okay, we'll give the score 5 to Team A. Next. Now we are at the 10th round. Team A.
At the end of 9 rounds, Team A is at 185, Team B is at 130, Team C is 150, and Team D is at 60.
Team A, are you ready? Each question carries 10 marks, and it can also be passed to the next team, and they will get 5 marks. 20 seconds. 20 seconds. Ready? Identify.
Lipid emulsion, 20% lipid emulsion.
Correct. You'll get a score. Take team B. Team B. Change
HFN.
Huh?
Anaesthesiologist.
Will give what is the term? So it is an extended application of HFNO. It is HFNC cannula, that is Thrive. We'll give the marks for the team B. Team C. Identify this.
LMA gastro.
Wrong. We'll pass it to the next team D. Wrong. Now. Correct. LMA or Naviana, you would get green color chocolate pudding. Nilina. This looks like that it is LMA Protect. Now team D. Identify. Timer on madidira.
Enfluorine vaporizer.
Very good. It is enfluorine. Sevoflurane looks like this. Good. Now audience round. Is special round. You take a rest. We'll come back to you for the last round. Now you can't answer. Audience round. Will request somebody to stand and answer so that we can give you some gift. It starts now. It has got only 4 questions. Only first answer will be considered. Should answer by standing so that we can identify that person.
Pass the mic to them.
ಹಂಗ ಆಗಲ್ಲ ಬಿಡಿ, ಕಷ್ಟ ಆಗ್ತದೆ. ಇದೊಂದು ಟೇಬಲ್ ಇಲ್ಲ.
Let them raise the hand.
Appropriate single word related to anesthesia. No, I don't consider as a quiz master.
Inhalational agent.
No. Heli, Grishma. No. Next. If you Google it, it comes only with that word.
Vaporizer.
Correct. Vaporizer. I got this idea when I was typing vaporizer. I got only these. I never got inhalational the vaporizer equipments. Next. Audience, our next question is local anesthetic agent developed by Central Drug Research Institute of India. It was invented, developed by Indian Research Institute. No. Medi. Correct. It is a trade name. We'll accept this answer. It is Senbicridin. It is marketed as. Next. Identify this monument or the building that is related to Indian anesthesia history. I'll give a clue. It is in Calcutta. If we put a ether dome, we will all jump and answer. It is unfortunate that it holds the similar history and similar reason. Now that is second clue. Yes. Correct. Not demonstration. First, ether anesthesia in India on 22nd March 1847. We'll consider that answer. Just 5 months after the publication, this is Medical College, Calcutta Medical College. It's still called Medical College Hospital, Calcutta. Next, identify these journals. This is only for PGs. Because we often see they are not seeing this because of online versions. Only for PGs. which is IJA in that? There is one more journal also. I will make it like that, hope, probably.
It's IJ and KG.
Next. New question illa, but that is also wrong answer. Correct.
Journal of Anesthesiology and Clinical Pharmacology.
ನೀವು ಸ್ಟಾಫ್ ಅಲ್ಲಿ ಏನ್ರಿ PG ಕೇಳಿದ್ ನಾನು. ಆಯ್ತು, ವಿಲ್ ಟೇಕ್ ಗ್ರೀಷ್ಮ ಕೊಡಿ. That is Journal of Anesthesiology and Clinical Pharmacology, and this is Indian Journal of Anesthesia. Next, one more question. Only one more extra question. Identify this single word. Not single word, terminology. Through this, you should get to some conclusion of Pictionary. All words read carefully. Correct. Complex regional pain syndrome. Next, we'll shift back to participants. The last round, clinical round. Are you ready now? Take and rest. Team A, one question, 10 marks. Will not pass it. There are no negative marks. Sir, scores, please.
So now that we are entering the final round, at the end of 10 rounds, Team A is at 195, Team B is at 140, Team C is at 150, and Team D is at 70. So there is a close competition between Team B and Team C, 140 and 150. All the best for all the teams.
Unfortunately, I have not made any question for tiebreaker. 145 and 150. Okay, we'll start now. A 68-year-old woman with a long history of smoking has been listed for laser debulking of laryngeal tumor. From the list below, select the most appropriate lasing medium for this surgery.
India.
We don't take that answer. It is carbon dioxide laser that is widely used. To just explain, carbon dioxide laser medium is used as a laser scalpel for cutting and coagulation of soft tissues that primarily contains water, including the laryngeal tissue. Argon is more commonly used in dermatological or ophthalmological surgery. Helium YAG laser is used in urological surgery, lithotripsy, and Nd:YAG and is used in GI bleeding, and Ruby is less commonly used, mainly used for plastic, that is hair removal or tattoo removal. Next question. An 18-year-old man is brought to intensive care unit following an attempted suicide. It is unclear how long the patient was in cardiac arrest. The team in the ICU department, they achieved ROSC. Now he is transferred to intensive care unit, but after testing, he is declared brain dead. His family have consented for organ donation. Overnight, he becomes hypotensive despite multiple crystalloid boluses. What is the next step in the patient's management? IV fluid bolus or noradrenaline infusion, adrenaline, phenylephrine, or vasopressin?
Commence infusion of vasopressin and titrate are required.
Good. So because IV fluid, because of their vasodilatory shock, it is not going to help. It causes more harm than good. Now, team C. A patient is undergoing cardiopulmonary bypass of coronary artery bypass, that is grafting. The surgeons are ready to insert a bypass catheter, but wish for the patient to be appropriately coagulated. Okay, what is the target ACT, activated clotting time in seconds, to insert aortic and vena cava catheters after administration of heparin? What should be target ACT?
By 20 seconds.
Heparin is usually given at a dose of 300 to 400 international unit to achieve a clotting time of greater than 480 seconds. Now, Team D. A 45-year-old woman is to undergo a free flap reconstruction of her breast following a mastectomy for CA breast. The surgical team has opted to perform a flap surgery. The patient is otherwise fit and well and has no other comorbid conditions. What is the most important hemodynamic goal to optimize flap perfusion and operative success? Which is most important among these? To maintain hematocrit, to maintain mean arterial pressure, IV fluids, to prevent hypothermia, therapeutic subcutaneous heparin. Which is all these are important, which is the most important? Very good. Prevent hypothermia is the most important goal whenever we do these free flap surgeries, because hypothermia causes extensive vasoconstriction and it forms a vicious cycle. It causes a rejection of the flap. Good. So that ends the quiz. Thank you all. And I request.
That doesn't end the quiz, because at the end of round 11, Team A is at 195, Team B is at 150, Team C is also at 150, and Team D is at 80. Over to the quizmaster.
So the tiebreaker will be only between Team B and Team C. First place is already decided, sir. First place. Now the tie is okay. Dinesh sir, score.
Team A is the undisputed winner with 195 at the end of all 11 rounds. For the second place, we have a tie with the Team B and Team C tied up at 150 each. And Team D, very good effort. They have scored 80 points. Now there will be a tiebreaker between Team B and Team C. The quiz masters will tell the details.
So this round is only for Team B and Team C. Dr. Anil will read out a question. Okay. So if you know the answer, press the buzzer. It's a buzzer round. And if you answer correctly, that team wins. If you answer wrongly, the other team wins because you earn a -10. Right? Is it clear? Any doubts with the tiebreaker? This carries a negative mark. If you press the buzzer and you answer correctly, you win. If you press the buzzer, if you answer wrong, you lose. If both of you don't press the buzzer, we'll go for another question. Right?
I never expected this. I even warned them not to get tied. Okay. Now, after question, will you buzzer or after? Okay. Central neuroaxial blockade is contraindicated in all except platelets less than 80,000, patients on aspirin, patient on oral anticoagulants, patient on IV heparin.
Patient is on IV heparin.
Wrong. Patient on aspirin. No more contraindication for spinal anesthesia.
Just by remaining silent, Team C1.
So at the end of the tie break, we have the clear winner, Team A, Shri Satyasai Institute, Dr. Sai Kishore and Dr. Parameshwari with 195 points. And Team B, Team C from JNMC KL University, Dr. Aditya Gopal, SS, and Dr. Deepak B, 1 point.
Consistently, all the three quiz, surprisingly, the Satya Sai team has scored top. All three consecutive quizzes, they were the highest scorers, followed by JNMC. And here also the same thing has happened. So congratulations to all winners. And today's sponsor are Accurella and our Dr. Basuraj from Nirmala Hospitals and BMH Bangalore. ಈಗಲೇ ಮಾಡ್ಬೇಡ. Now I request Dr. Manjunath sir to take over and carry on with function.
Good evening, everyone. Thank you very much for a very nice conducted state level quiz program. I thank the quiz masters and quiz master Dr. Anil and the team, along with Dr. Anup, Dr. Sarika, Dr. Mahadev, and not to forget the efforts of Dr. Dinesh and team. They've put in Dr. Vaidyanath. They put in a lot of effort in conducting this program. Since many days, I was behind them. Is Dr. Satvik, Dr. Mahadev, everybody, they put in their heartfelt effort to finally conduct this program in a very good manner. I thanks each and everyone. At the same time, our sponsors, this main events is mainly the brainchild of our Abhinava events. Mr. Vidyashankar just told me to conduct this program in Gulbarga conference. I just tried this, and I don't know how far it will be successful. I think it will be definitely successful. We're going to conduct this ISA quiz program in the next coming years in all the conferences. We thought of incorporating this quiz in this manner. I would like to call upon Mr. Tushar Gangadhar to the screen to give the first prize winners. I would like to thank all the organizers and at the same time all the participants from different parts of the Karnataka, from Satyasai, from Mandya, from GNMC Belgaum, and from KIMS Hubli. So they participated, but only thing is they are all just sitting very quietly with a lot of I think they should bring out their smiles on their face, and they're totally they're into the shell because they wanted to answer it. That's the way. Okay, this is the way it happens. So finally, this first prize winner, I will call upon Tushar to give away the prize. I think as already I will call upon Quizmaster Anil to announce the. I would like to thank the IAS Mysore City branch, which has given a lot of encouragement. And I like to thank Dr. Usha Madam, President, IAS Mysore City branch, and Dr. Vaidya, Secretary. Both of them give us a lot of encouragement in conducting this program. I would like to call upon Dr. Usha Madam to the screen, the stage to give us the praise. I will call.
First place is masters goes to Anaesthesiologist, goes to Dr. C. Kishore and Parameshwari from Sri Satya Sai Institute, Bengaluru. And Accurella has sponsored rupees 10,000 and a gift ISA City Branch, Mysuru.
Certificates. Thank you. Thank you for the first prize winner. Thank you, madam. Thank you, Mr. Tushar and Taka. Yeah.
Yeah. I request Usha ma'am to give the certificates. and medals. Okay. Now I request Manjunath sir to hand over the second prize check to Dr. Aditya Gopal SS and Dr. Deepak B from JNMC Belgaum. I request Usha ma'am to hand the certificates and Madhav sir to third prize goes to Mandya Medical College, Dr. Pankaj and Dr. Harish.
Finally, it is because they participated this, all the teams. We don't want to with them. So we want to give a consolation prize for the last winners. So fourth place winners, we want to give consolation prizes. Come forward and receive the prizes. It is sponsored by Nirmala Hospitals. Like Dr. Basaraj. Okay. So, Dr. Akaba madam, come to the dais. You can come and give.
You pose it there. So we request for a group photo, all participants. And we
Yeah, at the same time, we thank the Abhinava events for clearly conducting this program very nicely, and there is no hazards in that, and it was a successful program. I would like to thank this the Abhinava events, Yashwant, Prajwal and team to come forward to the dais and get a bouquet at least. No, you have to come to the dais. Prajwal and Yashwant, and they done a very good job. Well done. And on behalf of the state ISA state Karnataka state chapter and ISA Mysore city branch, we congratulate them for successfully conducting this event, and there was no hitch at all. And I thank Mr. Vidyashankar along with Yashwant and the team, the Prajwal and team. So I would like to give a bouquet to the, please give a bouquet. Yeah.